Charlie, more health news this morning. Let's be honest, there are just some things that you dread telling your doctor. And this can be especially true for older patients who may find certain things embarrassing. And chances are, though, don't worry about it because your doctor has heard it all before. And Dr. Abaje is here to tell us what you need to know. Take a deep breath and tell it like it is, right? You've seen it all. Right. You've heard it all.
That's right. And usually when people are in the doctor's office, it's a sacred, safe space, and you can talk about most things. But still, even with that, people don't talk about important topics.
And I think the older you get, too, there's also a sense of pride. You know, you might want to talk to, you might not want to talk to your doctor about certain things.
Well, that's one thing. And also, sometimes people just think that this is part of getting older, and they don't even think of it as something to bring up. So it can also be that they don't even realize that it can be a problem.
But you said there are certain things that are very embarrassing, and they could be a sign or symptom of something more.
That's right.
So let's go through some of the things you suggested. You said urinary incontinence.
Right.
Anything related to that might be something that you don't want to talk about your doctor with. But
right.
You have to.
Absolutely. So when people are having problems holding their urine, it can be because of many different things. The first thing we always think of with older adults, and not just with that symptom, but with any other symptom, is it related to some of the medicines they're on? And so these are very simple things that older adults can talk about with their doctors and healthcare providers, and maybe there's something that can be done to help them with that.
So how would you recommend that they talk to the doctor about it? Because that can be embarrassing.
Right. So a couple of things. One would be to kind of think about in advance of an event where you were embarrassed by one of these symptoms. So if it's urinary incontinence, let's say you were out shopping and you lost your urine. Maybe you were laughing, maybe you were sneezing, or maybe you just couldn't get to the bathroom in time. So I would think about one event and really describe it to your doctor and describe what happened around that. You don't have to keep track of many of them. Just start with one and say, look, I have a problem that I wanted to bring up with you.
What about the patient who's too embarrassed to talk about, the fact that they're depressed or their mood has changed or their energy level's awful?
Yeah, this one's really important because this is something that's very stigmatizing, especially around different cultural issues as well. So the first thing that you might want to say if you're feeling like things aren't quite right is just that, doc, things are just not quite right. I don't feel quite like myself. And then that can open the door. And if you're not quite sure what else to mention things that others have said to you. So maybe your loved one has said, I've just noticed that you're not sleeping as well as you used to be, etc. And important to think about with depression is that it doesn't show up the same way it does for younger people. It can show up as irritability, grumpiness. It's not necessarily the sadness that we often think about. So it's important to mention.
The last one, which I don't think, you have to be an elderly patient
right.
to clearly suffer from this, but memory loss. And it really can be an embarrassing thing, if you feel like I can't remember anything.
Right. Memory, we're always worried about dementia, Alzheimer's, these types of things, and memory loss is important to talk about. But it's not just memory. So if you're having trouble finding words, if you're having trouble locating objects, that kind of thing, really important. And the reason it's important to bring up, again, because it could be related to medicines that you're on, simple thing to work on, or it could be related to a recent illness that you had. So it doesn't have to mean that the end of the world is coming with a big diagnosis, but you're not going to know unless you bring it up.
Okay, and again, she's a doctor, she's heard it all, she's seen it all, and really that's the case that I think people have to remember, right?
Right, just to feel like it's a safe place to bring it up, and if you don't feel comfortable, then have a family member with you that can help you. And the opposite as well, if you want to be alone with your doctor to discuss it, that's also a good idea as well, so just bring it up.
Always confidential. Well, if you're curious, we're going to put this interview online, so if you missed something that the doctor said and you had a question or you want to learn more, just go to abc2news.com. Always good to see you,
Nice
Doctor.
to be here, thank you.
Thanks for coming in.
Thank
Charlie.
you.